Hello, welcome. I'm Dr. Geoffrey, crisis and split-second decisions expert, bringing you another update on the crisis of COVID. And we have new information that will help everyone. The question is, do we know how to recognize symptoms? Some of us have gotten pretty good about it, but there are new symptoms. Do you know what they are? We're going to get to that. I'm a board-certified emergency medicine physician who is also a crisis and split-second decisions expert. I go around the country and the world training companies on how to manage crisis, as well as how to make split-second decisions, how to make sudden and urgent split-second decisions. But as a result of COVID, all of us are forced to be executives within our own house. We've got to learn to make split-second decisions. And more importantly, we've got to learn to function within a crisis, because personal crisis is going to hit all of us. But right now we're in a countrywide crisis. And today, what we're going to learn are the newest symptoms. The question is, are they new? And the answer is no. It's just that now we're getting data to support them and to verify them. This thing about asymptomatic carriers, if you've noticed, the list of asymptomatic carriers is getting smaller and smaller, meaning that people have had symptoms, we just haven't recognized it. So as every month ticks away, we're finding out more and more symptoms. Hey, that points towards COVID. I'm gonna get started, but I'm gonna wrap it in an ER story. And by the way, I take care of active COVID patients. Prior to back in December and January of 2019, January 2020, colleagues and I were talking about, hey, are you seeing a lot of flu patients? And a lot earlier, and are their flu tests negative? We're like, yeah. So we didn't make much of it. And lo and behold, there comes COVID. Now, I'm not saying that all those patients who presented with flu-like symptoms were actually COVID, but it made us wonder, hey, was that COVID coming and we didn't see it? Now, in the last several months, a lot of colleagues and I have been talking, just random, we talk about cases, and we've been talking about, patients coming in, and they're just coming in because they claim that they're so tired. We're like, why do patients come in because they're so tired? And we were wondering, okay, we were thinking it was because of COVID. People were feeling stress. And then we were getting these non-specific headaches. Well, let me get to the point. People who are COVID positive, 82% of them experience a headache. 72% of them experience severe fatigue. That's feeling very tired, like you can't get out of the bed. Feeling very tired. Headache and fatigue. These are new symptoms that they're not on the CDC site that only come out within the last couple of weeks. Headache and severe tiredness. And this affects all age groups. The reason why it's so important, that is nothing. No, it's something. The reason why that's so important is because don't forget, the concept is if we can identify COVID early, or someone with the potential of COVID, we can isolate them right away. And this is even more importantly for those of us who have at-risk populations who live with us or who we know, such as the elderly, people with immunocompromised conditions. If you start to get these symptoms, you want to isolate away from them right away. Hey, follow me. I've got some data to prove this. 9 out of 10 COVID positive people, 9 out of 10 experience headache or fatigue. Headache or fatigue. Let's be clear. It's a non-specific finding. It doesn't mean you have it, but it makes your antennas go up. Now, 9 out of 10 people COVID positive experience headache and fatigue. What I'm about to say now may point away from it, but it doesn't. It is a non-specific finding that only 1% of people overall who reported headache and fatigue had COVID. Meaning that just because you have it Just because you have headache and fatigue, it doesn't mean you have COVID. It's a non-specific finding. It just means, wait a minute, feeling a little more tired here. No, I'm getting a headache, and I don't normally get headaches. It makes your antennas go up. Whereas something like loss of taste, loss of sensation, that's highly predictive that you have COVID. If you've never had a loss of taste, loss of sensation, and you all of a sudden have it, it's predictive that you most likely have COVID. Within medicine, we call that the specificity is high. But let's go back. Just because you have a headache and tiredness doesn't mean you have COVID, but it means that your antenna needs to go up, especially if you don't have it. It may mean that you need to get COVID positive. You may need to get COVID tested. And if you've been around people, it may mean that you may need to isolate until you can get that COVID test. And then, but the classic triad is cough, fever, loss of sensation. Cough, fever, loss of sensation. Cough, fever, loss of sensation. Now, did you hear what I said? 9 out of 10 people who were COVID positive, had headache and tiredness. But they had other symptoms. Only 3% of people who were COVID positive was the only symptom, headache and tiredness. So there are other symptoms. The most common one are fever, cough, loss of smell. Fever, cough, loss of smell. But people keep getting caught up on this fever, and I get it, because we like go places and they take your temperature, and if it's normal, they let you in. That's just one data point. Keep in mind, as I've had to share with my daughter, trying to go places and say, well, nobody has a fever. Only 40% of people present with a fever. Only 40% of people present with a fever. Only 40% of people present with a fever. That means that just because you don't have a fever, it does not mean you have COVID. Let me just bring this home. The whole point of this talk today is a headache and tiredness is something that should raise a flag for you. A headache and tiredness is something that should raise a flag for you. The whole goal is to protect the most vulnerable populations. Those are the elderly, or moms and dads and gammies and poppies and grandparents and those people who are immunocompromised, diabetes, HIV, cancer patients. We have to protect them. That means whenever we've got a sign, we need to make sure that we isolate from them. And then finally, coming next week, we're going to give a talk about, well, first of all, let me be clear. Oh, by the way, any information that I present comes from peer-reviewed academic journals, Dr. Fauci, the CDC, the WHO, and a listserv that I'm on with a bunch of doctors. When the information that I am presenting is outside of that, I will share that. For instance, next week, we're going to talk about ways you can have Thanksgiving safely. Now, officially, let me be clear. You should not be gathering during COVID, during Thanksgiving. But the truth of the matter is many people will. So if you're going to do it anyways, next week, we're going to present how you can do it as safest as possible, even with elderly people. And keep in mind, many of us have children who are coming home from college, and that's a high-risk group. Real talk, for those of us who have children who are coming home from my college, you may want to think about getting them a hotel room and not letting them stay in the house. But we can talk about that next week. Anyways, this is Dr. Geoffrey. This is what I do. I live into organizations, and I go into organizations and train on crisis and split-second decisions. But as a result of COVID, I find myself going into some Fortune 500 companies, and I live with their employees daily just to keep them updated. You can follow me at YouTube at Dr. Geoffrey, Dr. Geoffrey, Geoffrey. LinkedIn, Geoffrey Mount Varner. Hey, it's Friday. Be safe, be careful, do something kind for someone, and together we're going to get through this. Now we'll take a few questions. Oh, my disclaimer. Thank you. Anything I say is not, don't take it as medical advice. It's just medical information. Nothing I say is medical advice, just medical information. And by the way, next week we're gonna talk about what you need to have at home in case you get COVID. And we've been talking about the vitamin D. Oh, and as we know, we see that it's your dude. I've been talking about vitamin D since, rarely do I take credit, but I will. Since March, April, I've been pushing this vitamin D. Now it's reached mainstream media. Now all the studies are showing, whoa, vitamin D. But there's some other medicines out there. There's a cocktail of 4 of them that you should either be taking or have in the house for when you have symptoms. Taking or have in the house for like when you have symptoms, because we need to be prepared if we get COVID. If we get COVID, we need to be prepared, and you don't want to wait till you get COVID also and say, oh, I need this, and this, and this. Start taking your vitamin D now. I would encourage you. There's a bit.ly attached to this. It gives you what you should do in case you get COVID. It's the COVID toolkit. And then keep in mind, when we're in a crisis, we're all making split-second decisions. You don't want to wait until it's time to make a split-second decisions to learn how to do it. So I would hit that bit.ly attached to this and get your book, Train Your Mind in Making Split-Second Decisions. Now we will take questions. Hey, Marlo, what's going on? Rita, hey, nice to see you as well. Selena, what's going on? Selena's taking notes. All right. Hey, Frank, what's happening? Haven't seen you in a while. Hey, Frank, you always remind me about that disclaimer. And one day I will tell you how that is so important. Because while everyone appreciates the information in this normal setting, when things go wrong, you've got a different person and they react differently and they refer to stuff. And so that disclaimer it is absolutely key. Sandy, what's happening with you? Frank, my question is this. Here we go. My question is about COVID testing. Do you have any opinions about the nasal swab test versus the mouth swab test or the efficacy? I don't know much about it, but what I do know is that the current standard, and because there are a lot of swabs out there, in the hospitals, when we do nasal. Sites in the DMV, most of them do nasal. I don't have any objective data, but I think that question will probably keep coming up. So reach out to me, and I will be sure to get you an answer. But what I will say is, a swab, whether it be nasal or oral, y'all already know this, but share with your friends. It just tells you about what's going on right now. It just means you've got COVID right now or not. But I will say this. This is not what's recommended, but it's been my experience, especially from the phone calls. If you found the need to go get tested, more than likely there's a reason that made you go get tested. So once tested, while you're waiting for the test, you got to isolate. Yeah, while you're waiting for the test, you have to isolate. I'm not just saying that. Been through it. Been through it personally. Been through it with my son as well. In summary, once you get COVID tested, if there's a reason that led you to that, besides I'm just trying to figure it out, you should isolate until you find out what the test says. Hey, what's going on? Katrina McMillan, what's happening? Haven't seen you in a while. Hey, this whole lockdown got many of us tired, fatigued, and don't want to get out of bed. And the stress of it is headache inducing. Selena, I hear you. And believe it or not, while that's in line with the theme today, there is a pandemic of mental health going on, and this locking in and wearing the mask and not being able to see people, especially the grandparents, not being able to see their grandchildren. It's creating a national stress, which is why I'm still encouraging people. You've got to do something to let it all out, whether it be running, walking. You have to continue exercising. But I hear you. I definitely hear you. Tanisha Kraft said, vitamin D and what else? Tune in next week. I may turn that into a 4-part series. I'm just playing. I don't have time for a 4-part series. I will share with you next week, trying to get this download developed. But continue to take your vitamin D. Hey, Dr. Geoffrey, Melba Sanders. My doctor has been making me take vitamin D3 for years. And your doctor sounds like he may have sense, because keep in mind, the darker you are and the older you are, especially over the age of 65, doesn't matter what color, but the darker you are, the more likely you are to be vitamin D deficient, just because your dark skin does not allow the sunlight to be converted to vitamin D as efficiently. And no matter what color you are, because the skin changes for older people, you're not able to convert vitamin D from the sunlight as efficiently. And most of our vitamin D comes from the sun. Very good question. Can a person with COVID-19 take a walk outside? Can a person with COVID-19 take a walk outside? Let me back into that. That's what Adrian White says. A person who's she's asking if someone who's COVID positive, can they walk outside? And my answer is, if there's no one outside, there's no one around you, and you're not going to run into anyone, absolutely. And in fact, I would encourage you to do that. And if you want to be super safe, take your mask with you just in case. Why? Because when you have COVID, the one thing you don't want to do is, I needed to do a lot about this, but it's lay in the bed, get all comfy. No, you want to keep those lungs as active as possible. You want to have a pulmonary toilet. You want to breathe hard, walk, whatever you do, keep those lungs active. So I would encourage you to go outside, but do it safely. Socially distance, wear a mask, take your gloves. If there's no one around, you do not need to have on your mask. If you're outside, there's nobody around. Why? COVID, you don't release COVID into the air and it travels for miles. By the way, COVID, it drops to the ground, and if there's wind blowing, it just blows away. This is not like TB or malaria, which is really airborne, which can be airborne, and it blows for miles. It's not like that at all. Very good question. But I would encourage you, gotta watch how I say that. Whatever you do, get some exercise. Jacqueline, your information insight has been helpful. That stress thing is real. I'm glad you referenced it. All right, so the stress thing is real. All right, let me tell you how. So for those of us who've been COVID, who have tested positive, the studies are showing the sicker you are, the greater likelihood that you have a 60% chance of having some mental health difficulty. Again, some mental health difficulty, whether it be increased anxiety, increased stress, OCD, and insomnia. And that goes away with time. But the sicker you are, the longer you are probably going to have it. But if you weren't sick, there's still an increase. There's still an increase in anxiety, post-traumatic stress, and OCD. I'm not sure where the OCD is coming from, and difficulty sleeping. And for people who've never experienced that, you say, well, that's mild. That's how I saw it. So I've taken care of a few patients who've never had anxiety. As a result of COVID, they're now experiencing anxiety, and let them explain it. It's dramatic. It's dramatic. And then there's just a mental health fatigue that goes along with this COVID period. So anyone, I would say this. This is my opinion. This is not based on any information. I'm just using some common sense here. Given that the world's never seen this, given that we're expected to exceed 400,000 deaths by the end of the year, this is something that we were not prepared for. Anyone who's not experienced any type of mental difficulty at some point, I would say it is abnormal. It's abnormal. But just because you experience mental difficulty, take a moment, give yourself a hug, cry, call a friend, be gentle with yourself. Just don't stay there. Take a moment and move on. Take a moment, move on. And I'll be real with you. Us ER doctors, we commune. Sometimes it's a super busy day or there's a difficult case. We say, hey, just take a moment. and then you got to get back in there. So don't be too hard on yourself. What about vitamin D3 and K2? Right now, Dr. Geoffrey is only endorsing vitamin D3. Why? Because I have academic peer-reviewed information that I can verify and testify to. And by the way, did you see Dr. Fauci, older white dude, he's taking 6,000 units of vitamin D a day. 6,000 units of vitamin D. The current recommendation, depending on which national agency you like use, is between 400 units to 1,000 units. Dr. Fauci is taking 6,000 units a day. I think I've shared with you in the past that me and my family, we started off taking 25,000 units a day for a while, and then we cut it back, and I think I'm taking 5,000 units a day, and my kids are taking less. My wife's taking like 1,000 units a day. But Dr. Fauci, 6,000 units a day. And did you see one of the medications that President Trump took was vitamin D? Here we go. Mine too. Antoinette Rogers wrote mine too. I'm not sure what that means. Mine too. Yeah. So look, this one I'm gonna promise you all. I'm gonna have a Johns Hopkins psychiatrist that we're going to do a full talk on anxiety. And on the mental health as it relates. His name is Dr. Jonathan Shepard. I'm actually doing a show with him later on today. I'm gonna try to stream it here, but we're doing talk on mental health. Hey, you all, let me be like very clear. Don't be hard on yourself. This mental health thing is real. So don't think, is it me? I'm being weak. No, you're not being weak. We got a real crisis going on. We got real crisis and different and unique decisions going on. I can already tell you this. One thing that's causing you all stress is daggone, what am I going to do about the holidays? That's real talk. Am I going to go see mom? I'm going to let mom come see me. I'm going to let guests see me. Da-da-da. That's real talk. And the CDC says, no gathering, but we all know many people are. So that's a stressful thing as well. So don't be too hard on yourself. What I would encourage you to do, besides prayer, is exercise. Prayer, exercise, get plenty of sleep, and limit your intake of alcohol. Why? Because often when people drink, afterwards they feel more depressed. But by the way, I'm not a psychiatrist. I'm an ER doctor. I don't, besides my psychiatric patients, that's not my area of specialty. And let me go here. Jacqueline wrote, Doctor, Antoinette, right? Doctor has me on vitamin D for years now. Good. All right. Good. So team, that's it. The information that you need to go share, because after all, we've got to be super educated so we can be super spreaders of information. I thought that was funny. Make sure you go and share with your neighbors and friends. Hey, headache and fatigue. Those are signs that you could have COVID. Headache and fatigue. 9 out of 10 COVID positive people had a headache and fatigue. But then you've got to wrap it up and beyond say, but if you take all comers, people with headache and fatigue, only 1% of them had COVID. In other words, it is a data point that you've got to watch. But a month ago, 2 months ago, three months ago, you come see me in the ER telling me, doctor, I'm tired. I got a headache. I'm discharging you. But now I've got to think, do you have COVID? And now that many ERs are testing it, that may lead me to test you for COVID. So the symptoms that you need to know, and I promise you that next week I'm gonna have a graphic ready for you. The triads: cough, fever, loss of taste. But you should also start thinking about headache and fatigue. There you go. All right, a few more questions, then we're gonna wrap this on up. Hey, Johnny Black. Johnny, what's going on? I haven't seen you in a while. Johnny, what's going on with you? Johnny says vitamin D. K2 goes with vitamin D to keep calcium from leaching up. So Johnny Blackwell writes this. He's not a doctor, but that's what Johnny Blackwell writes. Dolores Numbers, what's going on? Hey, so in summary, have a good weekend. I would encourage you all to be safe. I would encourage you all to watch, to choose a source of information that you're going to follow. information's all over the place. I use academic peer-reviewed journals. Peer-reviewed journals. I don't read the Atlantic, all those other places. No, I read the actual articles. Then I use the CDC, Dr. Fauci. And if you listen to Dr. Fauci talk, he drops a lot of nuggets. Like the WHO and a listserv that I'm on with a bunch of physicians. Because here's a question that we're all going to have to deal with. When the vaccine comes out, how are we going to decide if we're going to take it? All right, I'm gonna get my soapbox for just real quick. Follow me, just follow me. Have you noticed that within the media, whenever there's an issue, they bring people that look like them to like share the message? For instance, if they want to talk to Hispanics, they bring in a Hispanic, and if the Hispanics bring out voting, that's what they do. If they want to talk to the older population, they bring out older people. If they want to talk to the blacks about voting, they bring out stars and athletes and politicians, black, and they do it that way, which is fine. But have you noticed that as relates to COVID, even once they found out that COVID was impacting blacks differently, I didn't see a lot of black doctors on TV. I didn't see a lot of black doctors on TV. So what that said to me is like, wait a minute, why are you all doing it differently? And trust me on this one, you can't say that there are no black doctors. So that seemed odd to me. But the troubling part is they've not made the leap to the next step. When this vaccine comes out, they've got to set somebody up to endorse it. And I would just encourage you all to find a black doctor on TV so you can learn to like trust them, so that when that question comes, should you take this vaccine or not, you've got somebody you can trust. That's just my little personal take. All right, let's wrap this up here. Does a fever always accompany other symptoms? No. Stephanie Fiver says, does a fever always accompany symptoms? No. In fact, I said earlier that a fever may be present only 40% of the time. A fever may be present only 40% of the time. And Selena writes, on the real, I took my morning walk earlier this week and boo-hooed the entire 3 miles. I felt better. I'm scared of everybody. I love you. Oh, Selena, that's real talk. See, that's what this is about, real talk. Selena said, look, I went out, I wasn't feeling good, but I cried the whole time, but I felt better. Take your moment and you feel better. Take your moment. But what was most important that you said that I appreciate, you went for your walk. Look, a lot of you all like to instant message me, and I appreciate that. And you ask me questions. I can tell you why my enthusiasm stays up, because I get my runs in 3 days on, day off, 3 days on, day off, 3 days on, day off. Boom. And that gives you something. I would encourage everyone to get some kind of workout in. Selena said that the stress is real. Selena, you're not the only one. I can tell you that of the probably 5,000 people who are eventually going to watch this, 4,500 of them are kind of experiencing the same thing. So, hey, I appreciate your like candor, and I appreciate you like keeping it real. And what happened to Surgeon General? So it's funny. Antoinette said, what happened to Surgeon? I don't know what happened to him. The issue is that because of some missteps, there's some questions about him. But what I have noticed is that, I'm a Black American. We all know that. Love everybody. But I think what the media has done is they have substituted. I mean, they think that people of color means Black. People of color means Black. I watched the show. Women of color. I said, oh, great. I wanted to watch it. It was on a national program. And there were no Black women on it. And I said, oh, this is what's going on. I'm not making a political statement, not making a judgment call, but people of color no longer means Black. For a while there, it meant Black. It just means, so I think that's what's going on. I don't think that there's anything nefarious going on. It's that people think that people of color means Black. I am specifically saying that there needs to be Black doctors, Black doctors on the mainstream media who that when this vaccine comes, they're able to, and they need to get on there early. They need to get on there early because you've got to develop a relationship. We got to trust you. They've got to get in there early. So when the vaccine comes, there'll be somebody that we can trust. That's just my own bias. Adrian, hey, I do appreciate that. You like trust me. I do appreciate that. Everybody, be safe. Before I go, although mine is a little slow. If somebody could just put in there, just tell me something good that's happened. Like I can tell you this. A good friend of mine had COVID, recovered just fine, is doing just fine, recovered just fine, and is doing just fine. So I was really happy for him. He isolated, has family in the house, and he was still able to isolate. And what did I miss here? Someone else talked about the stress. Hey, Dale Grant, what's going on with you? Stress. There we go. Frey. All right, again, team, I promise you, I am going to get a psychiatrist on the show, not because I think you have mental issues, just someone to just update us and someone to like give us strategies, meditation, eating well, working out, but definitely whatever you do. And I say this most humbly, we're in this together. Sorry, someone outside. We're in this together. So if we're in this together, reach out to somebody. Reach out to your soror, to your neighbor, to your fraternity brother, somebody you went to undergraduate, somebody you've not spoken to in a while. Just call and say, hey, I was thinking about you. How are you? That could be just enough to break whatever cycle they're in and give them just enough to put them over and say, hey, I'm good for another day. Boom, I'm good for another day. But again, if there's anything you can do is to be kind to one another, wear your mask and vote. Wear your mask and vote. Wear your mask and vote. Hey, Dale Grant put some good news in there. Takesha Ford, what's going on? Dale Grant said he voted early. My man, Dale. For those of us who are not voting early and who've got to go in line, check out my YouTube. I may do it on Monday. I told you how to vote safely. Just real quick, there's 5 things that like you need. 1, your mask. The better the mask, even if you get a double mask, if it's not an N95, do that, even if it's crowded. Your gloves, your hand sanitizer, your hand wipes, carry your own pens with you. And the last thing, if you can get one of those personal fans to keep from blowing, basically you're blowing the COVID away. Anybody who has COVID and you're inside, it blows, it kind of spreads. It doesn't make sense by how I put it that way, but if you watch the live or the YouTube I did on it, I explain why that's important. And then finally, take an umbrella. Take an umbrella in case it's raining, but hold on. When it's raining, often there's a corridor that leads to the building. So sometimes people get into the corridor. Those corridors are not ventilated. So therefore, if you have your umbrella, you can say, I'm good. I'm way outside that corridor until I'm able to pass through it. And if you have your umbrella, that's how that works. Whatever you do, vote. Let me take these last few. We're going to rock and roll out of here. Takesha, what's going on? Dale. Yeah, Takesha, you knew. Oh, yeah. COVID-19 is no doubt a crisis. We are in a crisis. And things are unfortunately going to get a little worse. Within medicine, we're making adjustments because this is real. Alicia Turner writes, I walk approximately 45 days a week for mental health. Bonus weight loss, and doctor took me up. Alicia says she walks 4 to 5 days a week just as her mental health. And as a bonus, she lost some weight and took her off her blood pressure medicine. Hey, give me a few hearts on that. Good job. I'm proud of you. Good job. April Sneed writes, my daughter's school district wants us to make a decision on whether or not we will send our child to school for the hybrid schedule, but they're not giving us the update on school safety until after the date. We must make a decision. Hey, April, if you could wait till Monday, I promise you I'll do it on Monday. If you wait till Monday, I will redo, because I did a whole series on should your kids go back to school. And there's some factors you've got to consider. Let's be clear. 40 states are just on the rise. 40 states are like on the rise. until we do that, our child's school, both our children's school, which is the same school, we're forced with the same thing. Right now, we're not going to send them. And here's my thought process. That's no official recommendation because everything's on the rise. The feeling is, and I have no crystal ball, everything's on the rise. I think they're going to go in and close back down. Why am I going to expose the kids for that short period of time? Now, there's a mental health reason, meaning that many kids are experiencing some of my mental health issues. So if they just need to go and be around their friends, then go ahead. But I'm going to do a live on children and safety and schools on Sunday or on Monday, because that question's coming back up. Very good. So, and hold. Oh, I said that. I'm sorry. But parents, for those of you who have to send your kids to that school, don't feel bad. We all have to make decisions that are in the best interest for the family overall. In the best interest for the family overall. And I'll be honest, if this happened to me 10 years ago, when I had less control of my schedule, my children may have gone to that school too, and they were younger. So if you guys send your children to that school, hey, it's okay. Don't forget, 99.9% of children do just fine. I'm talking to Selena 3. I'm taking a couple of first-time voters in New Jersey. Yes, in person. They need to experience. Selena, do that. However, listen to my YouTube that I talked about. That YouTube part 4. Whatever you do. So the recommendation is, if you go vote, drive alone unless the person who you're driving with lives in the same household as you. Why? Because otherwise, you have someone who's in the same car with you. It's a closed environment, and which means that if someone has virus, it's the greater the concentration. It's greater the concentration, and the greater the length of exposure. The reason why that's important, follow me. So COVID is not a one-to-one transmission. We're going to go a little bit longer today. COVID is not a one-to-one transmission. Meaning that just because say this pin is Sally and I'm Geoff and I have COVID. Just because Sally's in the same room with me, it doesn't guarantee that she's going to get COVID. There are two main factors. The concentration of the virus, meaning how much COVID is around, and the length of exposure. The length of exposure. One way to decrease the concentration you are exposed to are masks. And if it's a cheap mask, you double mask. And then the other thing, and the way to decrease your length of exposure and the concentration is ventilation. Ventilation, plenty of air circulating, a fan, that decreases. Therefore, back to my point, a car is a closed environment. It's a closed environment. So if you're taking them to like vote, hopefully they're riding separate. They're riding separately with you. And if not, if they have been in the same car, windows down, everyone masked up. But great job, good job. Whoa. And there you go. Okay, all right. Jacqueline Rice, I've walked. Jacqueline Ray Moore says she's lost 20 pounds from my walking. Great job. Kareem, I've discovered yoga during this pandemic has kept me centered and a good workout at the same time. Good job. My pandemic anxiety level went way down. So yoga, great one. Doesn't matter how the weather is. And April, you're welcome. Alicia Turner, Jacqueline, this is great. Walking is keeping me sane throughout. Hey, I feel you. And last question. Hey, Selena, you have the best information. We're walking, Doc, less than 3 blocks. Hey, the fact you're walking, good stuff. Hey, join me on Monday at 12 noon. May do one later this week if my daughter's softball game is canceled. But again, be nice. I'll talk to you soon. Please be sure to share this with other people and be nice to someone out there. This is Dr. Geoffrey. I'll see you soon.